We have two patients that we want to bring into the discussion. They may have questions for Dr. Lebovics, but I'm going to start with Victor James, if that's okay. Victor, I'm going to let you unmute yourself and I'll introduce him. Victor James was diagnosed with GPA in 2012 after an emergency tracheotomy. He lives in Stafford, Virginia. He's lived there for 61 years with his family, and his family has lived there for generations. Victor was an Allstate agent from 1982 to 2018 until he retired on medical disability. His first experience with the Vasculitis Foundation was at the symposium in Philadelphia in 2013. And he thought that was a pretty amazing experience for both him and his wife. And I'm so glad he said that, because there is a great symposium coming up in July in Chicago from the Vasculitis Foundation. But Victor says that they learned so much about vasculitis at the symposium that he became a patient of Dr. Merkel as a result. He drives 200 miles to Philadelphia to continue with Dr. Merkel as his doctor. And he's been lucky enough to be in remission since 2013 with only one flare of his GPA. And I will say Victor is also a Vasculitis Foundation board member. So I want to say welcome to you, Victor. And I would like to ask you if you wouldn't mind sharing a little bit about your journey with vasculitis.
Okay, sure. My journey with vasculitis started back in January of 2012.
And Victor, we've lost your camera. I'm not sure if you want to be on camera or not, but we've lost you. There you are.
Can you hear me now?
Yes, hear you and see you now.
Okay, sorry. January 2012, I started getting sick, thought I was having sinus infection, routine everybody's aware of. And that went on for 4 months through multiple doctor's visits and trips to the different doctors, the ENTs, trying to get a diagnosis. Lots of antibiotics, but nothing cleared me up. And then in April, I got to the point where I was very ill, very difficult breathing. And in 1 week, we had 3 trips to the emergency room with telling them I had difficulty breathing. And they kept telling me there was nothing wrong. They thought it was my heart. And eventually, after the 3rd ER trip, my ENT worked me in for an emergency visit, and they scoped up my airway and said I was 100% obstructed. So they rushed me via ambulance, and I had the tracheostomy done at 2 a.m. at the University of Virginia in Charlottesville. They took good care of me, and it was after the tracheostomy, my ENT said, at the time, I think you have Wegener's, and they got me in with the rheumatology department, and we started treatment. My first treatment consisted of 80 milligrams of prednisone a day and methotrexate. After 18 months of treatment with methotrexate and prednisone, I wasn't getting any better. And when I went to the symposium in Philadelphia, and I got involved in a clinical trial with Dr. Merkel with the rituximab, and the rituximab worked to put me in remission. I had one flare in 2016. That was after I was off all rituximab and wasn't taking it any longer. Now I get rituximab every 6 months, keeps me in remission. As far as I have the trachea still, the damage is quite lengthy, so the resection is not an option. So right now I've just decided to live with the trachea. I breathe well. So life is good, and I'm blessed that I've not had any more flares, and I'm continuing with rituximab. And I just like to encourage everybody. There's a lot of clinical trials that are out there that we can be involved in that help other patients. And if you have an opportunity, consider doing that, or definitely consider the symposium in Chicago.
Well, thank you so much, Victor. An amazing story.